Dr. Piskin, are you doing orthodontic work or some type of orthodontic work, such as Invisalign or something in your office?
Yes, Invisalign is part of our practice here, and it's a great service. For those that don't know, Invisalign is a type of removable orthodontic appliance where you don't have to have wires and bands and brackets, and they're invisible when they're in your mouth, and you just have to take them out when you do your oral hygiene and when you eat, but you get excellent results. You have to be about 13 or 14 years old, at least for the second adult molars to be in the mouth for it to be done. But yes, Invisalign is part of my practice, and we love the results that we get from it.
Tell us the difference about, Invisalign, which is relatively, not totally, it has been around a decade or more, but tell us a little bit the difference between that, advantages/disadvantages versus normal braces, the metal, heavy gear thing here.
Well, like I said before, the advantage of the Invisalign is, number one, is the look. You don't see brackets or bands or wires, and the ability to clean.
Are they really invisible? Are they really invisible, those Invisaligns?
Yes, it's made of a clear polymer, and they are invisible. So, unless you're right on top of someone, a certain distance away, you might have trouble seeing that they have their teeth. Mm-hmm. And then the ability to be able to chew your food without food getting stuck around all the metal and the brackets and the wires, and the ability to clean your teeth and do your oral hygiene with proper brushing and flossing without the wires and brackets in the way. That's a great advantage.
And that's so you wear them that's because while you eat, you take those right.
They're removable. They're clear and they go on the teeth. But basically what happens is they're computer generated. So at the beginning, you have special molds of your teeth, and then the Invisalign a technician and the dentist decide where the teeth need to be moved and how they're going to be moved, and it's all on the computer. It's generated and you get these trays, and every 2 weeks you put a new one in. And as the teeth gradually move and shift and tilt the way you want them to, you go from tray 1 to tray 2, and it depends upon the degree of movement that you need to use. So every might only need a few trays. So the adults really like that a lot better. Some of them just do not want to wear traditional orthodontics, so that's something I'm certified here, is to be able to do Invisalign, and most cases can be done with Invisalign.
Wow, so basically what you're telling me is because most of us think, when we think of braces of, teenagers doing them, but what you're saying is adults can and should do orthodontics works also, and Invisalign is really good for them, because very obviously an adult running around with braces, he might be a little self-conscious about it for whatever reason. I can see why.
Most of the patients that want Invisalign, ask about it, inquire about it, are adults. They've either didn't have an opportunity to have braces as a kid. Their parents might not have been able to afford it. They were in a different financial situation that they might be in now, or they had braces and they didn't properly wear the proper retainers to keep the teeth from moving over time. Teeth can shift over time, and they want to fix what maybe has relapsed, we call it, or teeth have maybe moved a little bit more than they like to. It wasn't like it was when they finished their regular braces. Now that they might be in their 20s or 30s or even older, they want to make those teeth straight again.
Yes, it looks like a big advantage that A, you can see them, B, you can take them out for brushing, eating, and brushing, so that basically the spinach doesn't get stuck like on a flagpole on that metal braces. I can see that that's an advantage, because I have heard that people who wear regular braces have to be very, very careful not to get gum disease due to the fact of difficulties in brushing. Is that true?
Well, not just gum disease. It's very hard to do hygiene with braces and brackets and wires, but also if you don't do the proper hygiene, you're going to end up with tooth decay around the brackets. Sometimes you see the kids that weren't taking care of their braces and doing the proper thing with their brushing, they take off the brackets, and then all of a sudden they see on each tooth a little circle or white spot or brown spot where we call it decalcified. And so they have straight teeth, but they look lousy. So the advantage of Invisalign is that you don't have that opportunity. They can really do a good job with their oral hygiene, and they don't have to worry about the brackets being in the way.
Now, does Invisalign, due to the fact that the way it is done, does it go faster, or does it take longer, or is it pretty much the same in terms of length on how long it takes to straighten out, an equally, the equal teeth?
Well, I haven't done enough studies. I don't do those kind of things, but just from reading the literature, they say it's about the same time that it would take to do both. I can't be exactly sure on every case whether one might take longer, but I think it's probably the same amount of time.
And does the patient have to come in? You say that every couple of weeks he gets a new tray. Does he have to come in to get that, or do you give him a bunch of trays and he doesn't even have to come in anymore, or less? What's the deal there?
That's a good question. It depends upon the case. At the beginning, we might want to see them a little bit more often so that we know that they're doing the right thing and things are moving the way they should. If we're confident that they're compliant, then sometimes we might give them 2 or 3 trays. That would be 6 weeks that we might not have to see them, as long as they know every 2 weeks they have to move on to the next one. So there are times where we might not have to see them quite as often.
That's good. And so you said compliance. So basically with the Invisalign, one of the problem could be if a person decides to take it out, forget it after lunch to put it back in, goes playing, doesn't come back, even loses them, maybe children, maybe, and maybe even adults, that they find too many opportunities to say, oh, I have that all-important interview or that all-important date, and next thing you know is they take it out a lot, and by doing so, I guess, forfeit their results.
The compliance is key. That's why we don't use it on children, because they lose the trays, they forget where they put it, they take it out, they don't keep it in correct. So compliance is very important, and they're only going to get cheated on themselves. They're never going to get the results. They're never going to be able to progress unless they really follow the amount of time that they have to wear. Because if you keep it out during the day a little bit and you tell the dentist, oh, it's been in, the tray is not going to be right the next time. It's not going to fit. It's the tooth kind of move back to where it wanted to remember it to be, and it has memory, and the teeth won't move the way it was designed to be done when we first did it at the beginning.
Yeah, it's like cheating on exercise. I know all about it.
You know all about it. You look good.
All right. Good. So, all right. So that gives it. Anything else you think we should know about Invisaligns, especially since you're doing so many adults, when do they use it? Why, should they be afraid of it? Is there something good about it? Do you have any stories which, people like it and, save money by not shaving down their teeth and putting veneers on it and lumineers and I call it clip-on fingernails and stuff. Is there some advantage to using that?
Okay, let's go. All right. You want me to answer it? Do you want to edit this? Or you want to ask me the question?
Answer the question.
Okay. I didn't know it was a question.
Okay.